thought it's going to be more crisis when we see ambulance staff holding their first strike for 30 years, up to 100,000 nurses also walking out next month on the 15th and 20th of December. And, of course, we're also seeing excess deaths, non-COVID excess deaths as well, affecting much younger people than COVID ever did en masse. Let's talk about all of this right now with Jamie Jenkins. He is an independent statistician. He's also former head of health analysis at the Office for National Statistics. Good morning to you, Jamie.
Good morning, Julia.
Thank you so much for joining us. Let's just talk, first of all, if we can, about the impact of ambulance staff going on their first strike for 30 years, plus 100,000 nursing staff. Half of the trusts across England will be affected on the 15th and 20th of December. I think virtually all the trusts in Wales and in Northern Ireland. Scotland affected by different pay negotiations, so we're not seeing strikes there. But the impact of a strike of this nature, we're told not affecting emergency care, but nevertheless, this is going to affect care and it's going to affect outcomes, which is sort of where you get involved as a statistician's analysis of, like, you know, the impact on actual outcomes, who gets healthy and who stays alive.
No, yes. Good morning, Julia. And I think that the big issue you've got is that the pay demands are obviously quite excessive, and 46% of the whole NHS budget goes on wages. But if you just look over the last 6 months, you talk about ambulance staff potentially going on strike. You know, people who are waiting for those Category 1 calls, you know, the most emergency calls, they have been taking longer and longer and longer to get to patients, if some people get an ambulance at all. And the waiting lists continue to rise. We've got 7 million people now on a waiting list. Not all of those are emergency kind of cases, but we've got 400,000 more than a year. I was just looking at the figures myself yesterday that people are waiting for heart procedures. Now, that's gone up 50% over the course of the pandemic. Now, so we go back to February, compare the latest figures, we had a 50% rise in people waiting for heart procedures. And then you talk about the excess deaths figures. Well, what we're looking at the moment is that more and more people are dying of heart issues. So whilst on the day emergency care might not be affected, what we could be seeing is delays to more of the elective surgery, and that could lead to some deaths further down the line.
I mean, looking at some stats, and you put some out last night in a Twitter thread, which was a really interesting read, and about the number of people. You know, there's you know, was it 300,000 or 400,000 people right now waiting for heart procedures of some kind, and we've had some a family member who had some a heart issue had to deal with. We ended up without private healthcare to go private because the NHS completely and utterly failed us. Just completely, and it was like, you know, a 2-month wait to even get, you know, a heart monitor on the NHS. And I was so. NHS GP's daughter, I was so upset and angry about this. I'm like, you know, I thought we were so privileged that we were able to get those tests privately, which millions of families wouldn't be able to do, to reassure us. But there are so many people waiting for really very important operations that will save lives. And yet those operations aren't going to be happening for many people in time. That is really very scary in a first world country that is spending huge sums of money on their healthcare.
No, indeed, and you're right. So we've seen like this big 50% rise. So over 100,000 more people now on a waiting list for a heart procedure. And some of those will be at the very start of the waiting list. But what more is concerning for me as well, Julie, we very rarely saw anybody on the waiting list for a heart procedure for over 12 months. But that's going up and up and up now. And, you know, you got 5,000, 6,000, 7,000 people every single month.
No one in a first world country should be waiting even up to 12 months for. I mean, sorry, you have a heart issue that you should be seen within like 2 weeks. On what planet? When did we decide in this country that this would be an acceptable wait for healthcare?
And it's not an acceptable wait, Julie. And if you bring it all back to the nurses' strike, a lot of the nurses are saying it's not just about pay, it's about the conditions that they've got. If the government caved in and gave this money for the kind of the nurses, well, the doctors will ask for it. And then if the doctors ask for it, it'll go across the whole of the NHS, could cost £10 billion. And then the government's going to be backed into a corner there, Julia, because teachers will ask for it, civil servants will ask for it. Yeah. It'll cost an absolute fortune. So the unions are kind of being unrealistic with their demands. I think where the government's got their main issue is, Julia, they've uprated benefits with inflation. They've uprated the state pension with inflation. So they might need to actually uprate pay with inflation as well.
Well, this is the thing. You used the word excessive about the pay demands. I mean, realistically, they aren't excessive pay demands. If you look at the actual real terms impact on, say, nurses' pay since 2010 with pay freezes and then your 1% pay rise when inflation was slightly higher than that. And then, of course, what we're seeing with inflation right now, it wouldn't be unreasonable for pretty much everybody right now to be asking for sort of 10, 15%. But not everyone's going to get that. Most people are not in a position. We know that railway workers often end up doing well because they can hold the country to ransom and do that. And a lot of people will have a lot of sympathy with nurses. You're thinking a government that's failed on lots of fronts, and nurses who we were clapping for a couple of years ago for working on COVID wards, whose side are most people are going to be on? I think a lot of people say the nurses. But again, as you say, the affordability issue is there, which is that once you give it to nurses and or ambulance workers, you're into millions and millions of people demanding that sort of pay, and then we are into that inflation spiral, and we just keep going and going and going. What you want individually is you get your pay rise and no one else does, because then you can afford it. But that's purely selfish and ego-based way of dealing with it. But that would then not have an inflationary impact. But in terms of, you say like 46% of the NHS budget does go on wages. There is an argument, though, where there was 140,000, something like that, jobs that are empty, waiting for people. Something 40,000 of those, I think, are nurses in the NHS. If they're unable to fill those jobs because of a combination of pay, conditions, whatever it is, maybe higher pay is the answer. I mean, in any other area, you'll say, well, you can't get any truck drivers to do deliveries. We had this a year ago, didn't we? You'll have to pay them more. And they started giving bonuses to get people to go and train as drivers to drive all the lorries and supplies around. If you want people, you have to pay more. Maybe we just need to pay nurses and doctors more to make sure we've got enough of them so that we don't have excess deaths from people waiting for procedures.
Yeah, and that is one option, Julie, but then we have to accept, obviously, we're going to have to pay for that. Taxes would have to go up to kind of compensate that, or we look at the NHS funding model overall. There's obviously this the kind of talk coming out of Scotland of people paying for kind of things. There's about 47,000 vacancies for nurses in the NHS at the moment, Julia, and I think you cover it kind of almost daily. The kind of number of training places for medical staff, that needs to be expanded, excessively expanded.
It is absolutely mad, isn't it? Say, we just don't have enough people. We have to import people from abroad. Why? Why don't we just train more people? Everyone says, well, it costs a lot of money. Well, people dying because they can't get health care because there aren't enough staff also, I would say, is a bit of a cost to society.
Indeed, and it's not just a solution to import people from abroad. Obviously, that's good for the NHS, good for us, but is it morally right to start stealing other people's kind of healthcare workers? They'll all be in the same little situation to us. Yeah,
and also, again, it's all very well importing people from abroad, but we're going to get on to talk about the census in just a few moments. Where are those people going to live, and who's going to provide their healthcare for them as well? Let's also just talk a little bit more about those excess deaths, though, because you've been highlighting this, and it is very helpful to have someone who is a statistician of your standing. If someone, who would I trust to understand NHS data? Well, the former head of health analysis at the Office for National Statistics would be pretty much top of my list. Certainly not entirely sure I can rely on government ministers to deal with this. There seems to be this extraordinary sort of silence, a murder going on in the media, mainstream media, and across government about the excess deaths we're seeing right now. Because when we used to have sort of, every tiny increase in the number of people usually in their 80s and 90s dying of COVID, that no one seems to care about all these people in their 30s, 40s, 50s and 60s who are dying not of COVID but of other reasons, other causes right now. Now, there's a lot of concern that this is related to the vaccine. Is there any evidence of this, particularly related to heart concerns? Because the social media is awash with claims that this is all down to the vaccine. Have you seen any evidence in the data?
Well, the data I'm looking at doesn't kind of give you any information kind of on the vaccine. So that's kind of where the government needs to step in. They will have information on all of the patients who are dying, what their COVID status, how they've been going through the NHS and the pathway through their vaccine status. And that's kind of where the Department of Health can add that value more than what I can do by probably looking into the main causes of all of this. Now, Steve Barclay was on with Laura Kuenssberg recently, Julia, and you hit the nail on the head. Not one question. And we've had 28 weeks now in a row of higher than expected deaths when you compare the number of deaths in the country compared to the pre-pandemic. And again, we've had two mini waves of COVID. So if you strip those deaths out, it's those aged 30 to 59 where we're seeing some of the higher than expected deaths, which are a bit of a concern.
And a lot of those, and these are non-COVID deaths, and a lot of them are heart related. There seems to be the view that looks like a lot of it is people getting delayed treatment, delayed getting an ambulance, delayed getting treatment in emergency. But there is still this concern that, okay, some doctors said to me they think it's down to the damage to the heart from having COVID. But as I said, there is this concern, and we know there are impacts from the vaccines on people's hearts. That is really very clear, and some countries now, like Denmark and Norway, say they're not recommending boosters to under 50s, under 60s because of the concern about the trade-off in risk. Is this something that the government should be, and the NHS should be actively looking into?
They should actively be looking into, and probably it's going to require kind of a cross-agency approach using the ONS, using the UK Health, Agency as well. That needs to be done just to reassure the public, what's going on. The silence actually creates this kind of void that people start filling in.
If it's all fine, prove that it's fine. And if it's not, we should know about it. Again, the studies that they do, you think they might bother with this one, wouldn't you?